Welcome back to Wellness in Minutes, where we give you bite-sized health information that's easy to digest. Be sure to check out the show notes for details on the full episode and more from the Food Matters podcast.
I do want to say it's really normal in the lead up to the period to have a couple of days where you feel maybe a little bit more hungry and maybe a little bit more tired. And when I say that to women and they're like, what, that's it? I'm like, that's kind of it. That's actually where the complexity of the symptoms should lie. Women are really confronted by that because these issues that we're seeing are a direct result of our modern lifestyle. And nobody likes to hear that, but they really are so influenced by what we do on the daily. And I don't think we make that connection. I think we can make a connection of saying, I'm tired, therefore I have a headache, or I'm dehydrated, therefore I have a headache. But when it comes to the big drivers of hormone imbalance, mainly being stress, most of us have adopted stress to be just part of what we do. And if I say to women, you know, how do you answer this question? How stressed are you? The most common answer is, I cope fine. I cope fine with stress. Yeah. And like, that's not even answering the question. So it's really important that we start to put together the pieces that our hormones are influenced by what we do on the daily. And if we're repeating the process day in and day out of our cortisol levels being higher than they need to be, and same with adrenaline, and our body is fueled by cortisol and adrenaline, it's a coping mechanism that your hormones aren't going to be in balance. That's your body doing exactly what it's supposed to do under the circumstances. And so we really need to use our symptoms as clues to dive deeper into what is actually happening here and what are the steps I really do need to put into place so that I can actually live my life and not have to live half of my cycle, which a lot of women do, with horrible symptoms, meaning only 50% of the time do you feel good. And then for some of these women, they've got period pain. So that takes another week out. So they get 1 week a month where they feel normal.
Yeah, it's pretty wild. And I think your philosophy of this concept of trying to allow the body to be unimpeded as much as possible so that it can speak to you clearly. And then from that dialogue, you can start to address some of these underlying potential contributing factors. We'll get more into like estrogen and progesterone later in terms of correcting, because I'd like to sort of move towards the PCOS now, polycystic ovarian syndrome. So this poly and endo seem to be very common these days, like more than ever before. And I think like, you know, there's a lot of diseases that are common now. I mean, like diabetes, obesity, heart disease. But then for these type of illnesses, I mean, for women, it's a big challenge. And with poly, what's sort of happening in the body from your perspective? What's driving this? And how can women sort of start to process this, I guess, diagnosis and then move towards a treatment or correction protocol that might be a little less harmful than other ideas?
Yeah. I mean, I think firstly, we have to start to look at the reasons why this is happening and what the solutions might be, because the alternative, when I say alternative, the mainstream treatment is birth control. Again, here we are, you know, it's such a disservice to women to shut down their hormones and then expect that that's where the buck stops. So PCOS and even endo, let's just say both, just as an explanation, you're genetically predisposed. If you are presenting with it, it's in your genes. You can't change the fact that you're genetically predisposed. And I get asked all the time, how can you cure my PCOS? Well, I can't, because it's genetically your blueprint. What we do is we change the environment so that it doesn't become, you know, something that your body presents. No different to, I have eczema. You know, as a child, I had horrific eczema, and mum worked out how my lifestyle and nutrition and all the bits and pieces influenced my eczema. And so I lived like 20 years without eczema until I moved away and thought I knew better and ate KFC every day for lunch. And that's no lie, I did. I was like obsessed with the Zinger burger. And my eczema came back tenfold. It was, you know, everywhere. And then I figured out, actually, you know, my lifestyle's changed and tightened the reins and didn't have eczema again for 20 years until more recently after having COVID, it came back again. And so it just goes to show that, and I use eczema as an example because I think we look at something like PCOS or endometriosis and we think it's so serious, whereas something like eczema for most people is kind of less serious. It's annoying, but it's usually not taking over their life. I mean, it can, but in most cases it's not. So, in looking at what we've done there, we've just changed the factors that trigger that to present in my body. No different to PCOS or endometriosis. I mean, the triggers might be different, but genetically you're predisposed, and there's certain things we know that if you're doing can turn that presentation on. That's just your body responding to the environment that it's living in. So PCOS and endo as well, we say around 10% of women are suffering from endometriosis and adenomyosis. I think we should add that in there as well. And we say somewhere between 10 to 20% of women are presenting with PCOS. And then there's a crossover. Some women have both. They are different in terms of what your hormones are doing. And I think that's important to understand. And it's also important to look down the mother line and see where or if there's a history of this as well. Because if there is, it's very likely that you have the predisposition, and there's a chance that that switch can be flicked in your body. When it comes to PCOS, there's definitely a few factors we know, and we also now characterize PCOS based on presenting symptoms. So once upon a time, PCOS was you had to do, you did the correct testing, and then it was a matter of you having, elevated androgens, an ultrasound showing multiple follicles on the ovaries, and some of the other symptoms like facial hair, weight gain, hair loss on the head, acne, missing periods, obviously being a big one, or irregular periods. And if you met those criteria, then you were diagnosed with PCOS. In more recent times, we've discovered that there are different presentations of PCOS. You could have lean PCOS, you could have post-pill PCOS, you could have post-trauma PCOS. So looking at the history allows us to diagnose based on the circumstances and the presentation. Someone with lean PCOS is obviously presenting differently to somebody who has the traditional PCOS. And someone with lean PCOS more than likely has the follicles on the ovaries and has missing periods and has the elevated testosterone, but they're not gaining weight. And there's a few other factors that make it different. So there's a 6 to 7 phenotypes that we look at, and that allows us to really dial in how we would treat each of those presentations differently and appropriately. It's no point treating someone for elevated androgens if they don't have them. That's not going to get the outcome that we want, but doesn't mean that they don't have PCOS. And this is where I think medically a lot of women aren't diagnosed early enough, is because they're not necessarily presenting with true PCOS or that traditional PCOS. And medicine's still arguing about how we do this to a degree. It's still not clear on why or how. If we look at it from a more of a functional perspective, we can actually piece it together and figure it out. Yes, okay, you're genetically disposed. Then perhaps you've had a trauma, and then all of a sudden your period went missing, and then this has been triggered in your body. And normally with a trauma, there's not just the trauma itself, it's everything else that's associated with that becomes a factor. So, when it comes to PCOS, we need to, I say, fundamentally, we want to look at, okay, how is your body regulating, or what is your insulin doing? What is your blood sugar doing? Because that's a big driver. We know that when we're stimulating the ovaries, when insulin's not being utilized properly, it stimulates the ovaries to make more testosterone, and then we have these presenting symptoms of that more common type of PCOS. We also want to look at inflammation in the body. We know inflammation triggers everything. And if you're so predisposed, and that's a factor, then that's going to be a contributor as well. And then, of course, I think it's not going to be a shock to anyone that behind all inflammation, we need to look at what the gut's doing as well. So, there's these pieces that we put together. Our brain goes to hormones straight away. And yes, it is a result of hormone imbalances, but it's triggered. That's the end step. What are the triggers? We've got to come back to what's triggering that for somebody. And to be really honest, I find PCOS way more easy to treat than endometriosis. I find that if I can get patients to do some pretty simple lifestyle changes, that their body responds very nicely, and it doesn't require a whole pill cabinet to address. But it's about figuring out when it was turned on, what happened, and then being able to look at well, which switches were flicked on at that point in time, and how many of those can we flick off? Did you change environment? Did you move? Did you have a car accident? Did your lifestyle change? Did your diet change? Did you start working full time? Like, all of these things really do contribute to our presentation. So, that's what I look at with PCOS. And really, at the end of the day, if I can get someone's blood sugar regulated and their inflammation markers down, they start to cycle again regularly. So obviously, that's because we regulate their testosterone better. When it comes to endometriosis, it's a little bit different in the sense that whilst endo is not considered autoimmune, we treat it as such. So it's very similar to those patterns where we see a lot of inflammation in the body. We can see congestion in the pelvis. We obviously see endometrial growth of the tissue that mimics the endometrium, which means it bleeds when your hormones change, which hurts. And so when it comes to endo, I treat that the same principles apply in terms of being genetically predisposed and all the things we spoke about with PCOS. It's just that you're actually predisposed to endometriosis or adenomyosis, and we need to look at how we can, again, address the inflammation, address the pelvic congestion, and what other things and drivers are at the forefront of that. And the other thing with both of these is, again, coming back to my first part of this, conversation, is stress. Like, it's such a big factor. And you're saying, well, it's on the rise. Why are so many women now being diagnosed? We are living a life well outside of our capabilities when it comes to optimal function. It's not to say we can't do it. We're doing it, right? We're all doing it. But we don't necessarily, we still laugh at the idea of having to meditate, or we still laugh at the idea of needing to drink enough water, or we think it's funny if we don't sleep enough. Even though we know we feel better for doing it, the prioritizing these things, we're still kind of missing the mark on this. So, I apply these principles to all women that come. And, yes, you've got a diagnosis, but I think also at the point of having a diagnosis, it doesn't change the presentation. Your symptoms are never wrong and they never lie, and they are always going to guide you in the right direction, no matter what a test result says.
So you covered so many great things there, and you definitely have this very functional approach, which I love. And I think people tend to dismiss some of the simple approaches that you're talking about, but you're singing from a united chorus. You've got Dispenza, Bruce Lipton, Dr. Libby, all saying that, stress is the common underlying contributing factor to so much of what we're suffering from today because of how it downregulates the immune system. But then, especially when we're talking about PCOS and endo, these are hormonal issues, and stress in the body is a hormone. So, this is a really, really powerful connection. So let's talk to stress, let's talk to blood sugar levels, and let's talk to inflammation a little bit more as these three individual drivers. And maybe let's speak to individually some uncommon ways that people might be contributing to stress or inflammation or high sugar levels, because I think people think, I'm okay. But really, when you look at their life, you're like, no, you're not. Okay. So could you help highlight this for me and those listening a little more?
Yeah, absolutely. I think it's interesting because, and Christine Northrup speaks to this in her book, Energy Vampires. And I do want to highlight this part of it, because I can come in and fix someone physically, and I know that they will be better within a 3-month time frame. But if we don't address the driver, which is always some type of stress factor, they will be back where they started from 3 or 4 months later. I've seen it 1,000 times. And so stress, I think we look at stress as being, I'm busy or I'm overextended. I've overcommitted. I'm burning the candle at both ends and I feel overwhelmed, I would say, is the word that women identify with. I'm overwhelmed. But we haven't considered that stress could be the environment that we're living in. It could be a cluttered, messy house. It could be a relationship, not even with someone that we're actually close with, but somebody that triggers us constantly. Stress could be, the food we're eating. I don't think that's revolutionary. It could be how many hours sleep we're getting a night. Like, there's so many of these contributing factors. But I do feel like the biggest factor is our mental and emotional health. And that's the part that's the hardest to get right. And this is the person that says, but I do everything that you tell me to do, Nat. I eat well. I've reduced inflammatory foods. I've increased my fiber. I'm very big on fiber, and I'd love to talk about that because that is a game changer. I'm sleeping more. I'm moving my body. I'm doing everything, and it's not getting any better. And it's because there is usually some type of, whether it's recent and current, or whether it's a trauma that's happened at some point, or there's a person that's triggering that constantly, and that seems to keep us in this perpetual state. Also, obviously, you and I know our mindset plays a huge role. If we constantly wake up and embody endometriosis every day, even though you're doing everything to address endometriosis, it's never going to get any better. It's not going to change. So I think the other part of this is we are so conditioned to look for every part that's not working that we actually lose sight of what is working. And if I can get patients to start to focus on where the wins are, and we can start to snowball this, life just gets better. And it doesn't matter. The symptoms that are still there don't matter, because the focus being on health and well-being and what you're creating eventually outweighs the illness and the parts that are diseased. So that's the part that I think is missing. That's the biggest contributor to the inflammation, to the blood sugar, to the, that's the core of it. And I think that's the part that we're missing, and it's the hardest part. But I can say that if we get the physical boxes ticked, it's much easier to deal with this mental side of it and this emotional side of it, because you've broken the chain, you've broken the overwhelm. And one of the biggest things I say to patients is, I just need you today to be able to check in and bring to the forefront of your mind when you actually are feeling overwhelmed. I don't need you to do anything other than that, because if you're unconsciously overwhelmed, I can't do anything with that. You can't do anything with that. We have to get conscious to be able to do something with it. So checking in with yourself when you find yourself taking a deep breath because you're frustrated or overwhelmed or stressed, that's your check-in. That's you going, oh, you know what? I'm back here again. And it's not that you're not going to be back there. You could be back there 75 times today. How many times can you be conscious that you're back there? And then you can start to choose again. But whilst you're subconsciously stressed, there's nothing, you can't choose again because you don't even know that you're feeling that way. So I think the first thing is recognizing that's not normal. You don't have to operate out of a place of stress and overwhelm. Contrary to what you've watched your mother do or your loved ones do or your co-workers do, that's not where health comes from. And what if you could be curious enough to see if there's another way that you could go about your day that didn't involve you being overextended, that didn't involve you triggering your cortisol 75 times, that actually kept things down? I could promise you you can absolutely do it. It's just that no one's ever showed you that way before. You've never thought about it because you're mimicking your habits based on what you're seeing everybody else do. And we so often also borrow other people's opinions of how we feel and how we should act. It's not our own necessarily. It's somebody else's that we've borrowed, and now we think it's ours. So checking in with that as well. One of the things that I get told all the time, Nat, you're so busy. And I'm like, but am I? and it's no, everybody else.
I have a reframe for it. I stopped using the word busy about 5 years ago, and I changed it to productive.
Right. But here's the thing, to that point, people say to me all the time, now whether my life looks busy or whatever on the outside in, it probably does. But in my mind, I get to do a lot of things. I didn't just wake up one day and have all the things. It's been a process. But for, say, my loved ones that look at me and go, oh my gosh, you are so busy, I can take that opinion and start to embody that opinion, and it starts to become my daily life. Or I can be aware enough and go, but am I? I'm actually not. That's just your opinion. I'm actually some days I don't actually do much at all. It might look really busy, or maybe it is busy. I don't know, but I get to actually decide then and there, not based on what someone else is telling me, and really just sitting with my life, what I want to create, and what I want that to look like. So, there's all of these stresses we're being constantly fed all the time. And to your point, yes, they trigger inflammation. Actually, fundamentally, I would say, here's what happens. When you're stressed or overwhelmed, you can't digest and be stressed at the same time. Your body's not designed to do that. We know this. This is not revolutionary, but let's just think about it slightly different. But let's say that you are not eating well and you're stressed at the same time. So you're triggering your blood sugar's responding to that. When you spike your blood sugar, then you actually trigger inflammation in the body. When you trigger inflammation in the body, then you upset your sex hormones. That's fundamentally what's happening. So this is where I say to patients, there's 2 things that I want them to do. I want them to take a deep breath before they eat, five diaphragmatic breaths preferably. What's that going to do? It's going to take us hopefully out of fight or flight and into rest and digest. So at least we can digest. We're going to introduce fiber, and if you've seen any of the Glucose Goddesses work, I've actually had the privilege of experimenting with that with hundreds of patients, if not thousands. Holy moly, if everybody actually just implemented fiber at the beginning of a meal to regulate their blood sugar, therefore they're not triggering inflammation and they're not triggering a hormone situation where they're spiking their estrogen more than anything, I wouldn't have a job anymore.
Whoa.
But I have constantly talked about fiber for years, but now putting it at the beginning of a meal to regulate the blood sugar has been an absolute game changer for, I would say, every patient that's actually done it has come back and said, could it really be? My sleep's better, my cycle's better, my clarity's better, I'm not crashing in the afternoon because we've regulated blood sugar. And as we've already discovered, blood sugar and inflammation are 2 key things when it comes to PCOS and endometriosis and adenomyosis. Could it be that simple, James?
Whoa, I love this. So big. So Glucose Goddess, I love she's bringing awareness to this. Fiber was like so big in the 90s. Like it was low fat in the 80s and it was fiber in the 90s. Remember Metamucil, I'm regular.
Right. But can I speak to this? Because everyone rolls their eyes when you say you just need to eat more fiber. Let's just think about why. Fiber is generally a prebiotic, so it feeds the good gut bacteria, right? Fantastic, because that's where all imbalances really do start, in the gut with imbalance. And we know that we haven't done a lot of research in this area, but we do know that there is specific bacteria that regulate estrogen. And if you don't have them, that's the first missing step in regulating your hormones and your estrogen levels. We can talk to that in a minute. So we're going to feed the good gut bacteria. It's also a binder. The fiber is the binder that allows anything that we need to eliminate to be shipped out of the body. If you don't have the binder, how the heck is it going to get out? You have to have the binder to get out the excess hormones. So again, if you've got too much estrogen in your body and you're not moving your bowels daily, that estrogen sits in the bowel and gets reabsorbed and then back into your system again. You must have the binder to get out the estrogen. So it acts as a prebiotic, it acts as a binder, and it obviously helps to move things through the gut as well as regulating blood sugar at the same time. It's such a win. There's so many reasons why fiber isn't just so you go to the toilet. It's actually so much more than just moving your bowels. But it's the one thing I would say we've somehow moved away from, and we don't get enough of it, and probably because we were all tortured in the 90s that we needed more of it.
So yes, thank you everyone for listening. I really enjoyed that talk. I hope you did too. And there will be more of these on the Food Matters podcast, so head to foodmatters.com and see you again.